Hi, doctor. Are you currently seeing patients with shoulder pain? What about frozen shoulder? What if I could teach you a neurological treatment system in which you could literally take a person from frozen shoulder to a full range of motion in 2 visits? And this system is so powerful that we guarantee results in 2 visits, or we don't accept the patient for care. Hi, I'm Dr. Andy Barlow. I'm a board certified chiropractic neurologist. I also carry a fellowship in functional neurology, and every Wednesday night at 5 p.m., I'm giving a 1-hour seminar free of charge. I'm here to help you. I'm here to help your community. I'm here to help our profession go to the next level. I personally look forward to seeing you every Wednesday night. I want to completely change your life and change your community's life. And I can help you do that because I've helped hundreds, if not thousands, of doctors from Europe to Canada, all the way to New Zealand with these types of health issues. Okay. So I look forward to seeing you Wednesday night at 5 p.m. Central on the webinar. Have a great day. I look forward to seeing you on the internet.
Probably have an old school website, just like this old school Voltron from the 80s. Here's the thing, video websites are dominating the entire internet right now, but only 3% of people have video websites. What is a video website? When there's continual movement. The beautiful thing about continual movement is that when you have movement, it keeps the buyer wanting to stay on the website. Here's the beautiful thing. If you look here at Dr. Mo's website, he is dominating. His website's everywhere. Not only that, but he's omnipresent. It's about time to get you out of the static world websites where they don't move, doesn't do anything for you, but come into the video websites where we dominate Google and get you omnipresent. It's time to step in the future of marketing. Make sure you click on the button at the bottom for a consultation, and we'll get back with you.
Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine Show. We're here again. And today I have a special guest, Dr. Travis Whitney, out of, I believe, the Phoenix, Arizona area, correct?
Yeah. Phoenix, Arizona, correct.
Just want to make sure. I love that area. I call it the place where it's so hot that everybody has a perfect home. But anyways, that's no pun intended. But I know that if you guys are looking for Dr. Travis Whitney, I want you to take a look at innatehealthcare.org, innatehealthcare.org. The subject today is something that's real special to me. And not just that, but there's a lot of talk about stem cells. There's a lot of talk about stem cells being wrong by the wrong people, but there's also a lot of talk of stem cells helping millions of people. So today the topic is, what is stem cell therapy used for? And I just want to say thank you so much, Dr. Travis Whitney, for being here on the show. But before we let you go into your passion, tell us how you got in. Tell us a little bit about yourself and how you got into stem cell therapy, please.
Oh, yeah, sure. So I was born and raised in Florida, Northwest Florida, the Destin area, if you're familiar with it.
Oh, yeah.
Did school out there, and then I went and spent a little time in the Army. And then after that, I moved out to your neck of the woods, to Portland, Oregon. And I went to med school there, and I was a dual degree student. I got a master's in research, medical research, with a doctorate in naturopathic medicine. And then after that, I got another degree in Chinese medicine. And so I make the joke that I'm a recovering naturopathic doctor in the sense that I did the functional medicine, integrative medicine stuff for a while. And then my specialty was joint injections for a long time. I trained really, really early, starting like my second year of med school in joint therapies and injection therapies. And knew about stem cell therapy, but it was also kind of something where like the people that taught me injection therapy was like, yeah, it's not caught up in the field yet. It's going to take a while to get caught up. So, flash forward like 5 years,
right.
5 years later. So I had the opportunity to study it and train in it more. And I jumped on it and I was just seeing night and day differences in a lot of these other conditions I was treating and helping. I certainly was improving and helping a lot of these conditions, but man, when I say night and day, just getting people with grade 3 osteoarthritis, months and months of pain. Their only other option was that they were bone on bone. They had to have a knee replacement, and that was it. And within 1 or 2 weeks, just pain free. So that's not always the case, but it's just stuff that I've seen to where you really take a hard look and be like, wow, so this is really a thing for patients. This is really an option. So I started doing that full time, and I still integrate my other modalities and stuff. So my goal has been is just create the most complete, comprehensive, holistic care as I possibly can for patients.
Wow. I just want to say that you got me at when you mentioned that you have some Chinese training with what was it called?
Yeah, master's degree in acupuncture. And
right. Now, what a lot of people don't realize is I love a lot of the whole holistic with the Chinese therapies and stuff like that, because what the Chinese have taught us Americans is not just to look at the symptoms, but to look at where the underlining is, to take care of the root. So yeah. I love the fact that that you did that. Do you see how it's helped you a lot with what you're doing now with stem cells and stuff like that?
Yeah, I think they all contribute to each other. Every one of my modalities that I practice is all kind of getting to that root cause. That's the big philosophy of naturopathic medicine, of Chinese medicine. They all start with, you have to get to the root cause. You have to figure out what's going on.
Right.
And I love those modalities, but I wasn't getting as big of results as I would once I started adding stem cell therapy to it. So how I like to tell patients is, the stem cell therapy is going to really get the ball rolling. It's quickly. Making a lot of epigenetic changes to that environment of where either the cells are administered or depending on how they're administered and where they're going. So it's making a lot of changes in the body, but you can speed that up, and you can keep that going with other treatments like acupuncture, like other naturopathic approaches that we can do. We know metformin doesn't cure diabetes, right? We know nitroglycerin is going to relieve angina. It's going to relieve chest pain or heart, from like heart condition, but it's not going to cure heart failure.
Right.
Right. But all the approaches I take, they're all aiming to have that curative approach.
Very cool.
And I don't scream that from the rooftops. We can't scream that from the rooftops because the FDA is, you shouldn't say that.
You and I know why
you can't cure people.
You know why they want to muzzle you guys, right?
I have my
because it works. That's the funny part. I mean, yeah. I can say that, because it works, everyone. Now, let me tell you guys something. I'm a huge person that is pro stem cells. What Dr. Travis is going to explain to us today, or what he has seen stem cells do to his patients. Like, can you give us some, like, what you've seen it used for, that it's working majorly, that you've seen in your, since you've been doing it?
Yeah. I can give you a little both of, like, if you go to clinicaltrials.gov, you'll find a whole host of research, which is another quirk of mine when people say there's no research done in stem cells. Like, you're not looking in the right places, because there's hundreds and hundreds of research articles out there on it. Might be even in the thousands now, because that last update was like 2017-18. But any autoimmune condition, Crohn's disease is big. Any arthritic condition, lupus, heart failure, in a lot of research, MS is done. So I would say my top conditions that I see personally, I mean, there's even spinal cord injuries are even being treated. Severed complete spinal cord injuries are being treated with stem cells. So, but what I see and treat the most, joint, any arthritic condition is kind of a bread and butter. It's kind of almost getting old for me. If you have joint or like back pain or knee pain, it's just kind of almost like a done deal.
You're like, just come talk. I got this.
Yeah. Rheumatoid arthritis, osteoarthritis, any autoimmune condition, Crohn's disease, I have a few really good Crohn's that I'm talking what we call long-term remission. You know, since we can't say cure, we say stuff like long-term remission, where they don't have hardly any symptoms at all. I've treated about a dozen autism patients now. Really, really successful. I just got an email the other day from a mom checking in, and her son has learned 10 new words. So he's gone from being almost completely nonverbal to within a month having 10 new words in his vocabulary.
How old is he?
Having less outbursts. They're communicating and socializing a lot better, not only with the family, but with other kids. So any autoimmune component, I have a great heart failure. If you go to my testimonials, I have a great heart failure case on there. The guy 100% told transplant or die. And after we finished our therapy, last I knew he was traveling through Europe or something.
How old was the kid that you helped?
Most of the kids are 2.5, mostly like 3 to 5 years old.
Wow.
And I've treated some autistic adults as well, and have heard really good things. I actually had one of them, his dad put him on the phone, called us and said, I just wanted to tell you I'm feeling so much better and thank you. And yeah.
Unbelievable.
Yeah, when you hear stuff like that, it just warms your heart and makes your day.
So let's talk a little bit deeper in stem cells. There's a lot of people that they have the misconception of what stem cells are, you know, and where they come from.
Mm-hmm.
And I think that I've heard a lot of people talk about it, but I've never really explained it to break it down. Like, and I'm not saying you're not going to, but I feel like people need things broken down to third grade. We have a third grade audience, and I don't mean that in a bad way. We have high intelligence on here, but sometimes it's good to just break things down to third grade people. You know what I mean? I'm like, hey, give it to me second grade. You know, what are stem cells and what are they not? Because right now there's a big thing in the media right now going on. Stem cells are being talked about a lot right now, especially with the COVID thing. You know, I know that a lot of doctors are not supposed to say it, but I know that there's, you know, a lot of people that are getting healed from stem cells and stuff like that. And of course,
and there's a lot of controversy of clinics out there posing as stem cell clinics. Charging a lot of money for very poor medicine, and I don't even know if they use stem cell medicine at all. But so yeah, it goes both ways. There's a lot of people really, really getting helped by this medicine, and there's a lot of people they're getting misled,
right?
Too. So, boy, what is stem cell medicine, or what is stem cell therapy? I'll turn this down from a 1-hour talk on biology and physiology, and we'll narrow it down. So all your organs, all your tissues have stem cells. You know, they all have their different kind. You have your liver stem cells, your heart has stem cells. So the nomenclature that we need to get down to is when we're talking about stem cell therapy is from an MSC, or what's called a mesenchymal stem cell. So that's the stem cell that's aimed to being used when you hear like you're going to get, most likely when you're going to get a stem cell treatment or therapy. Those cells were kind of misnamed back in the day. They thought they came from connective tissue because the first ones they isolated were from bone marrow. And so they thought they came from this stromal layer of connective tissue. And fast forward after some more research, so they thought they came from like bone or tendon or anything. Well, what they actually do is they sit on top of our blood vessels, you know, arteries and veins. They sit on top of there, and they're called pericytes, meaning by or above a site. So they sit next to blood cells, and anytime any injury or any kind of inflammation comes into that area, they break off and they turn into what we call an MSC. And the proper name for an MSC, instead of mesenchymal stem cell, is a medicinal signaling cell.
Right.
Because that's what these cells do. They signal to the environment anti-inflammatory proteins, or probably know what an exosome is.
Oh yeah.
That's these little packaged vesicles inside the cell that go into another one and tell it to upregulate, make more of this protein or make more of this. So in the best third grade sense, they're like little pharmacies. They're like little clinics that respond to the environment, and they're like, here's some medicine for you. Here's some medicine for you. And they're talking to all the cells around them, including your own stem cells, which I told you, there's stem cells all over your tissue. So when I take stem cells and I stick them in your knee joint, they're going and talking to all your stem cells and your cartilage cells and your ligament and tendon cells and all this. And they're giving them medicine, is the best third grade sense I can say. They're saying, here's all the regenerative stuff that you need to be your best self.
Wow. But I know there's different types of, stem cells. I know that they can use some from your fat, I believe.
Yeah. So there's bone marrow procedures.
Right.
There's adipose procedures where they do a little mini liposuction, but the aim is all the aim. Unless somebody has cancer, they go through chemotherapy, that kind of wipes out like their red blood cells. So then you would take some bone marrow and you would get a stem cell called a CD34 positive cell. And that would specifically use to restore that person's like red blood cells and their white blood cells. So that's why you need to talk to your doctor, and you need to say, what kind of stem cell therapy am I getting? Because it's not a blanket statement.
Right.
It's not an across the board statement. You can get stem cells from dental, your gums. You can get it from menstrual blood. There's actually a company in India that pays women for their menstrual blood, and they store it for emergency stem cell treatments.
Wow.
Yeah. So there's all kinds of tissues, and there's all kinds of ways you can do stem cell medicine. And it's grown to such a big wildfire, storm or a forest fire that any clinic, all kinds of clinics out there are just advertising stem cell treatment. Well, what kind of stem cells are you using? How are you administering them? And what is your goal? What are you trying to do?
Right. So, and there's also where you can revive the old stem cells, correct? In your body.
Mm-hmm.
That's something that can also be done, where you can revive the old ones. I've heard of people utilizing certain machines that can revive some of the old stem cells in your machine to actually repair the body. Have you heard anything about that?
Are you talking about iPSCs?
Yeah, iPSCs.
So that's called induced pluripotent stem cells, and it is a capability.
A capability, right?
It is a capability, yeah.
But for how long? But for how long? That's the thing that I have in my head.
Yeah. So it's done. It's not the most common therapeutic approach, because it takes a long time. It takes months to make those cells do what you want them to do. So if I drew your blood and I had a stem cell biologist add in this or add in that to maybe have those CD34 cells transform back into a pluripotent stem cell.
Right. Mm-hmm.
Because, oh gosh, we said we wouldn't get too deep into biology or physiology, but there's a difference between a pluripotent and a multipotent. Those pluripotents can turn into anything. And so once they go into a certain cell line, like if it becomes a CD34 cell, now you have to turn it back into a pluripotent cell. Then they can make it dance and do whatever they want to do with it. But it's a long, arduous procedure. And it's not, I don't think it's going to be a first line therapy really anytime soon. It sounds really good. What blows my mind is that we've got umbilical cords all over the place, and umbilical cords are chocked full of these medicinal signaling cells, and they have this young, great epigenetic or genetic components to it that are primed for healing and anti-inflammation. And we've been tossing those in the garbage for so long.
Let's talk about that real quick. I want a freeze frame on that. I like that. You're talking about the umbilical cord. Now, there's a lot of people that are talking about the umbilical cords, and they're getting pissed off. Why are they getting upset about that? You know, that it's being used to actually help people. So my brain, I can't get around it. You know, why people get upset. It's helping somebody. It's not like the umbilical cord is getting thrown away anyways.
Yeah. I don't know, maybe ethical reasons. Maybe they don't think that birth tissue should be used. But I mean, maybe they're just not, they need to be educated. They need to understand this isn't a violation of the baby or the mom. They're done. They did their part. The umbilical cord has done its part. So instead of throwing it away, why don't we save it to help a lot of people? And
you know, I agree with you 100%. I'm thinking in my head, you know, and I'm not saying that this is so, but if it's no longer a part of that body, right?
Yeah.
And what if, you know, I mean, if that could even cure cancer, I'm not saying it can, but what if it did? There's so much stuff that we are throwing away and not realizing that we even have to actually help people. I feel like a lot of people are getting upset because they're like, oh, they'll say, oh, it's the fetal, you know, and stuff like that. And they don't have the correct education. And it's kind of frustrating because we live in a day of age now that we don't know what is real anymore, even if it's on the internet, even if it's on the CDC, you know, I mean, it's sad. What would you say to somebody that is right now on the verge of possibly going into surgery and making a recommendation of utilizing stem cells, or at least giving it a shot?
If they're going in, well, let's see, it depends on what they're going in surgery for. If they're going in for any kind of joint replacement,
right, or knee replacement, right,
that kind of you know, back surgery with the rods and replacing discs and stuff like that, I would heavily advise them to look into a good stem cell therapist that has a lot of procedures under his belt and has done you know, orthopedic, those kind of treatments. It's very much worth their while, because once you go down that surgery route, there's pretty much like no going back. Like
nonstop.
You get that knee replacement and it doesn't work, or if you get those rods and pins put in your spine and stuff and it doesn't work, and I'm not 100% against the surgeries or anything like that. I've met a lot of people that have had really successful surgeries. Exactly. I'm not knocking surgeons or surgery or anything. But if that goes wrong, that's kind of it. So I'd advise them to, at least, it's probably something they should at least look into. Anybody that's going in for any kind of condition, if you know, I tell a lot of patients, you do what you always done, you'll get what you always got. And so if you're kind of done and you're tired of that conventional route of then it's, you know, well, your options are pharmaceuticals or surgery. You know, that's it. If you're kind of over that, I'd look into somebody else. And if you look into a stem cell treatment, make sure you look for somebody that offers you stem cell therapies. So not one treatment. It's very unlikely it happens, and that's why a lot of people can promote it. You can get amazing results with one treatment, but really make sure you find somebody that has some sort of therapy set in place for you. That means
so one and done. We hear that a lot. So why not just one and done? I mean, it sounds great. Like I went to McDonald's and I went to a drive-through real quick. I'm good to go. I mean, one and done. Don't you recommend that? I mean,
no, I don't. It depends on the clinician. You know, I have people fly from all over the country to see me. So I do one and dones. It's not the best approach. I tell people, give this 3 to 6 months. Let's see if the dose, because I'm really good at what I do. Let's see if the dose and the treatment that I give you gets you happy and healthy enough to that's where you want to be. But it's, you know, you may need to come back. It's likely you may need to come back with another one. And, you know, thank goodness I get really good results. But you do have to be careful. There's a lot of places you'll go to where it's a small office. I'm not going to name what kind of doctors do them, but sometimes there's just a nurse and their advertising, not to get the nurse or anything, but their advertisement is just to come in and get a quick injection. And that's it. That's all you need is one little injection. So they don't talk about doses. They don't even tell people really what kind of stem cells they're treating them with. So just do your research. Same thing if you were going to get a knee replacement. Do your research.
Let's talk about the therapy that you were mentioning. What would that therapy look like?
That I do? Yeah. So depends on the condition, but I utilize all these tools that I've have in my toolkit over the years. So I talk about their diet. We talk about lifestyle. We use herbal remedies.
Love it.
We use PT. We use mind body training. So we incorporate this all into the therapy for as the most comprehensive, holistic approach as you can get. Because let's talk about another reality is that sometimes stem cell therapy doesn't work for everybody. You can hear, I've heard about it. I've heard people, they go, they do a treatment. They even go to really good,
right,
some renowned places in like Panama, or they go overseas and travel to places and they don't get any results. And so, if I'm picky because I'm like, well, yeah, that's because you just went to medical, at one place and all they did was one treatment and you kind of had really high expectations. So for me, I'd like to make it as holistic as possible because, why not? At the end of the day, you want your pain gone, right, or you want disease X improved. You want these symptoms improved. So why not do everything you possibly can to have that done, to do that?
I know for a fact that, that's kind of a bold statement, but let me backpedal here. So I know that with the type of, with the Chinese medicine and with the holistic and everything, and then wrapped around with stem cells, that people will be in good hands with you. And what's great about what Dr. Travis does is a lot of these stem cell doctors, what I'm seeing what they're doing, everyone, is they're just, they can help you with your pain and stuff like that. But sometimes it's a little bit deeper than just your shoulder or your knee and stuff like that. He mentioned the word diet. You did. And yep. I know my numbers will probably be off a little bit, but I would say probably 60 to 70% of that is going to help big time with the healing of your body, And so, I love Chinese medicine, and I feel like a lot of people don't understand it. So they just want a quick fix. So what would you say for, I know that stem cells are talked about, but I know they're not all created equal. Mm-hmm. There's some people that they'll go fly to Mexico for a stem cell. I'm not bagging on Mexico here, okay? But I'm saying that they'll go there because it's cheaper instead of getting it done here in the U.S. Or there's people that are in the U.S. that are getting their stuff from different countries that are lesser value stem cells. What would you say about something like that?
I do know people have had good treatments in Mexico. But the funny thing I hear about when people talk about going overseas is a lot of times they think or assume it's cheaper. And so I'll do an apples to apples comparison, to them. I'll say, well, what are they charging you, when you go to the Mexico clinic? Oh, well, they said, they said it was 10,000. Blah, blah, blah. They pick you up from the airport. They have your room covered, all those nice bells and whistles and stuff like that. I'm like, well, you can have 2 treatments with me by the time you went to Mexico and did that. And plus I'm right here in the States. Like you can call me and you can come see me again for ancillary, care. Like if the stem cell is going to do the bulk of the work for like an autoimmune condition, or a pain like a neuropathy or a bad joint or something. But maybe somebody also has a little bit of anxiety and depression. Is that going to be helped from, I don't know, you're big going overseas? I don't think they're going to really care about that. So why not go see, my claim is that why not go see doctors, like my clinic, where we're like, well, why don't we just treat you holistic as a whole person and improve all your facets instead of only, injecting your knee and then like sending you on your way, And that takes time too. You can't just shove all this stuff at once and say, all right, well, we're going to fix your indigestion, your GERD, your depression, your insomnia, your anxiety, your knee, back pain, shoulder pain, which is a lot of patients. It's
Right.
a lot of what we get, you know.
Yeah, I'm excited about. I love stem cells. I feel like it's still in its infancy. It's funny. My father's has shoulder problems, and man, I tell you, he used to be a bodybuilder.
Mm-hmm.
He's been acting up, and I said, just get stem cells. I mean, it's not going to hurt you, you know. I think some people are just stuck in their ways. They just think, it'll get better. You know what I mean?
Oh yeah.
And it's normally not the case.
Yeah. Well, let's talk about that. Let's talk about the most common disease, if you can call it that, or condition that ails us, and that's aging.
Yeah.
Right.
Mm-hmm.
So I agree. I think despite 20 years into like research and therapy, at least of stem cells and stuff, I think you're right. It still is in infancy. Ideally, if the US doesn't screw it up you'll start seeing this stuff a lot more first line agent. You'll start seeing, if somebody has a heart attack, ideally that paramedic on the scene or that doctor right when they come will start administering MSCs right away to start breaking up that scar tissue that's going to be formed from the heart attack and start regenerating the capacity of the heart immediately. Just like it was $2,000-$3,000 10 years ago or whatever to get a big screen TV.
Yeah.
Now what is it? $500 $700.
$500-$700
that will drive the cost down as well if it becomes more of an abundant therapy. And aging, we're going to start seeing it used a lot more for aging as well, because those innate properties. I'm not plugging my clinic.
Haven't even touched that part.
The innate properties in MSCs are to regenerate and modulate the immune system. So it's going to be great. I don't call it anti-aging. I don't like that word because you can't anti-age. I call it age defying. We're going to start define the normal process of aging to where people 60, 70, 80, 90 don't have aches and pains. They don't, they don't have zero energy.
Instead of getting cut up, like, they've got vampire masks now. They call it, which I think is really cool. I'm still learning on that.
The vampire facials,
which
is
very
so we do aesthetics. I've done hair. I've done hair and face, and great for tightening up skin and growing hair.
Really?
Some really cool before and after.
How long does that work for the tightening?
How long does it last?
How quick does it? Have you seen it starts to work, and then how long would it last? I like that. We'll kill two birds.
It takes a few months.
Right.
It does. It takes a few treatments for both of those, and it takes a few months. But on comparing them, most vampire facials are done with PRP, right?
Yes.
Platelet-rich plasma. You take the blood out, you spin out the red blood cells, you put the plasma with all its growth factors and platelets in it. Well, stem cells are they produce way higher.
I'd rather use a stem cell than a PRP. I mean, PRP.
Well, I use them in conjunction
together.
If you're just doing the PRP, I think you're going to get a way more bang for your buck if you add the stem cells to it.
I think, you're right. I think the longevity of it, because if you just do PRP, correct me if I'm wrong, you're probably looking at having to do that every quarter or every 7 months.
Yeah.
Because the stem cells,
you want to do every 4 to 6 weeks, and you want to keep doing them in a row. You don't want to do one and then wait, 6 months.
But if you do it with a carrier, with a stem cell, with the PRP, I mean, I'm thinking you're probably looking at every year and a half, wouldn't you say?
Yeah, as a maintenance.
Yeah,
it depends on what people want. So, a lot of people, they don't want any wrinkles. I know. Want that to stay it. But yeah, 6 months, maybe a year out, you want to keep on doing them. People's genetics, everybody's different. You got quite a baby face, it looks like,
yeah, it does, but you got to get closer. I got the filter on. It's a joke. But I'm 44 going on 45, and I'm looking at certain areas already. It's funny, but that's why I love this show, because I'm actually thinking about putting my mouth where my money is, and trying something like my wife and I trying it. And then we
Yeah.
can talk about it. That's why I love regenerative medicine. This is beautiful. So I might have to give you a call on that.
Yeah. Yeah.
My wife, she's so game.
Oh, I bet. Yeah.
She's like, hey, I'm
I see a
47
lot
years
more women
old.
with
She's
the
like, I'm
facials than do the men.
47. I'm thinking, hey, you know what? I'm due. And I'm like, hey, we can do that. It's all, hey, I can hear her right now. She's already talking about it. I think she's having a hallelujah moment over here. She's like, let me talk to him now. I'm like,
She's going to come push you out of the way.
she's like, okay, this is what I need you to do. But what a lot of people don't realize is that they think that it's just the women. A lot of men want it done, and that would actually get it done. I know that I'm a pussycat. Like, I would never get surgery where they're cutting me open. So I love the fact that you just give me a needle shot.
Yeah. Yeah. Of course, we see a lot more women for the facials, but we see a lot more men for the hair.
Does it work great with the hair? Like, great?
Yeah, it does.
Wow.
I treated ED. Works great for ED. I haven't done women, but I've heard there is a thing where you can, I think it's called an O shot.
O shot.
So you inject around in the vulva and around the clitoris, and it heightens their sensitivity.
Really?
So they
and that helps with the hair growth.
What's that?
Yeah, but that also helps with the hair growth for the women.
Yeah, if women are thinning,
right,
having thinning hair, or if they're starting to bald or something like that, it's not nondescript. Won't work on women or men. They don't care. It's just gonna signal your body's own hair growth pathway and have it start growing.
I like that. That's pretty cool. What I love about this is that, so a lot of women have they have thyroid issues, which a lot of people, from learning from a lot of doctors, there's a lot of people that if they would just get their thyroid right, everything else would start to fall in place and function correctly. But I know a lot of women are losing their hair because of their thyroid. And that's something that you also treat too, not just you can help out with the hair, but also with the thyroid and stuff like that.
We do. Yeah. All of us are trained in bioidentical hormone replacement therapy. So again, when you're trying to treat an underlying cause, if somebody's hormones are shot, a stem cell treatment is going to help with that hair, but it's
right.
If you inject it into the hair, it's not going to help the thyroid problem. So you got to wonder how you treat. You got to think about how you're going to treat. Intravenous administrations have shown to help thyroid conditions and testosterone. I don't know about estradiol though. I don't think I've ever read or seen anything where they've increased estrogen production in like a postmenopausal woman. But yeah, I've seen improvements in thyroid and testosterone levels.
Wow. Okay, this is good. Yeah, because I actually have I call it not one and done, but kill two birds with one stone, because there's a lot of people that right now are struggling with the thyroid. I think the numbers are probably higher, but I would say 60 to 70% of people out there are having major thyroid problems, and they're just getting, they're not getting to the root of that, and they think it's something else, low immune.
Right. And then if you want to go further down the rabbit hole, you'll talk about diet and what they're eating and what's making your thyroid all of a sudden stop, especially if you're, 20s, 30s, 40s even. We call them endocrine disruptors. So there's a lot of food. It's seen in a lot of plastics. It's seen in a lot of environmental stuff that can inhibit that thyroid from functioning correctly.
No, definitely. A lot of us don't realize that we're allergic to most of the food out here. We're allergic to the food. I didn't realize I was allergic to gluten and dairy. I'm like, dude, what the heck?
Yeah.
But I was allergic to that all that time when I was a kid, and I didn't realize it. But I feel like the longer that we're morphing into this life, I feel like the food's getting worse. I mean, I remember a chicken was like this small. Now it's like this.
Yeah, you know what transglutaminase is?
Huh.
You ever heard of that?
No, I haven't.
It's called meat glue.
Meat glue?
And so meat glue, yeah. So look it up. Transglutaminase. You can YouTube some videos. I think there's a food scientist that does this on his YouTube video. he'll chop up a bunch of cheap, cuts of meat. He'll mix them in transglutaminase, and he'll make a filet mignon out of it. And it's not a real filet mignon, but he'll have it look like it's a fresh steak. He'll add some coloring and blood into it to make it look like it's red and nice and fresh. And that's stuff that's being done out there.
That's horrible. They're doing that in China. I was watching a video where they have this boiling water and they have all these concoctions they do, and they're creating cabbage out of plastic, and then people are eating it. So what they're doing, I stay away from China. Sorry, China, forgive me, but it is what it is. If I'll have to send you that video, but they're literally creating it fresh, then they're cutting it up, and then they're putting it right out there to sell. And people know that it's not real. So they're doing that with a lot of the foods now. And so that's why I'm like, be careful. Like, I used to be so anti-organic. You don't even know. I was like, it's a scam. I don't want to hear about it. And then I get married to my lovely wife 2.5 years ago. And I have to share this video. I did a funny video making fun of organic, and now I'm an organic freak.
Oh, nice. Yeah.
And, I remember saying, man, my before I met you, babe, my grocery bill was like $250 a month. And I go, now I met you, it's like $800. What the heck? Because I would get upset because I'm like, they're scamming us, but I'll buy it. But then I started to really look into it and looking at the difference of the organic and non-organic, especially with the meats. You can taste the difference with real homegrown, grass eaten animals than with the ones that are pushed with the hormones, So now when I see very cheap meat, I'm like, I know I'm going to get hurt.
Yeah. You're going to pay for it.
No, exactly. But it's sad now. Even now, we've got to be careful if it says organic, doesn't necessarily mean it is. So we do have to still do our research. That's why I think it's good to find some store that provides not just boxed foods that are organic.
Yeah.
But that they do meat, they do dairy, they do everything.
Yeah. And everybody responds different, and that's why,
totally.
That's why I have a personalized approach, because, stuff like keto diets and stuff like that, there's always some fad in the health field world. And it'll change monthly, it seems like, but there's
new research.
Right. New research will pop up, and this is the best thing and only thing for you to eat. So I take a personalized approach, and I break down, you got to treat everybody where they're at. And I break down, what have you tried? What have you done? What are you doing? Let's just run some allergy panels. Let's do some eliminations. Let's eliminate some foods. And it's very hard. Diet's very personal to us. If you have another hour, for your show, we can talk, go down the diet path, but it's something you got to address with everybody.
Well, I think the diet is actually, I would love to have you on talking about that, but I think that, and we'll have to actually make that happen. I think that diet's not talked enough. I feel like, we have all these other sources that help people, but not realizing that if you just change one major thing in your diet, your life will change. Like, I'll be honest, this right here, I know bottles are bad, whatever, but Crystal Geyser, I'm a huge fan of Crystal Geyser.
Oh, okay.
And the reason why, it's because, we've got, 60, 70% of our body is made up of water. Just, it's somewhere up there. I don't know the exact number, but we'll say 70, 80% is. And for years, I was drinking water with salt in it. And then a lot of people say, oh, that's fine. That's fine. But what I started to realize is, why not drink the water from the source? See, Crystal Geyser is actually from the source. And what's interesting is when I started changing just how much water I'm drinking. So every day I pay attention to how many bottles of water or glasses of water that I drink. And I drink for my weight size. I'm 175. I do 8 bottles. And let me tell you something, that right there keeps you cleansed, keeps you fresh, helps out with the brain fog, something that's small. Yeah. And then, of course, the type of foods that I'm eating. But I'm just saying, if you're drinking Kirkland water out there, people run. No endorsement to Crystal Geyser, but if you want to call me,
Yeah, you made a good point with the dosage. You know, everybody's dosages
Yes.
are different. You know, you don't treat a 100-pound woman like you would a 220-pound man. You know, we calculate our size for our autistic kids for the amount of stem cells because we follow ICST guidelines, International Society for Cell and Gene Therapy. So yeah, you got to personalize it, and that's my big. You know, that's the other half. We do stem cell therapy where we have people all over the country fly in, not to mention around Phoenix, and then we offer a personalized kind of a concierge kind of approach to where, you know, our patients they get genetic testing, so they get allergy testing, so we can see like what's affecting you. We have a great a company called RGCC. They test cancer lines, so they're early detection cancer, and so we provide that once a year to our patients. They can detect the smallest cancer stem cells, and they provide you with the best treatment approach for that specific kind of cancer. So medicine needs to be very, very personalized, and I'm really passionate about that.
I like that, and you know, and you're correct about that. And you know, here's the thing, I want to share this with you before we go here because I have a lot to want to talk about. I know you do too. So, there's two types of doctor. You've got one type of doctor that you're going to go see for 15, 20 minutes. We all know what that is, and they'll give us some pills. Whatever it is, you know, if you got a headache or allergies, he'll give you some pills. And, they spend 15, 20 minutes with you. Or you can be with a real doctor that's going to spend, you know, you're looking at 45 minutes to an hour or even longer, because they want to go to the root. I know that when I went to go see my first real doctor, oh my God, he spent 4 hours with me.
Oh my gosh.
No, I'm not joking. I'm like, for the love of mercy, like, and the only reason why he spent that much time because I was only in that area for that so long.
Yeah, that's good.
He normally
That's
breaks
nice.
it up an hour, you know, a good hour. I think that you really only need. But I mean, my first, you know, because I wasn't going to be in that area we're far from each other. But if you have a doctor that's going to spend, you know, 30 to 45 minutes to even an hour with you, I believe that, hey, you've met a real doctor because they're going like what you said. Okay, allergies, because that could affect with what you're going to do. I mean, you might say, okay, we need stem cell therapy, but then you might say, wait a minute. We need to put that on the shelf here. Oh no, you need it. Your levels here are really bad. Gluten, allergy, you're allergic. This is affecting this. So then that's what you do is you connect the dots before you say, hey, we're going to inject you.
Yeah. I had a COPD patient. You reminded me of saying that God, his COPD was just horrible. But the guy was also suffering horrible anxiety attacks because he can't breathe. You know, he's scared. So his anxiety went through the roof.
Right.
And so a lot of what I knew couldn't, besides stem cell therapy, can't really address that severe COPD. So the COPD relieved immensely, so very, very significantly after the stem cell therapy. And we were able to utilize other approaches for his anxiety and some other conditions that he had.
Like Chinese medicine?
Yep, like Chinese medicine.
Actually works very well, believe it or not. I think people don't understand Chinese medicine. It's not talked a lot about.
Yeah.
But think about a lot of the Chinese, they live a long time. You know what I mean?
Yeah. Yeah. Well, no, I think that's Okinawa. That's technically Japan.
Oh, okay.
That are considered one of the blue zones.
Right.
You know, Sardinia or Sicily maybe, but there's certain blue zones in the world where there's really, really heavy, high centenarians, people 100 years or older.
Yes. I mean, especially Italy. I mean, when they say 7 grain, they mean 7 grain. They don't mean 14 grain. We're 14, 15, 18 grain over here, man. I mean, you know, we're inventing grains and there's like only 7. You know, it's like, come on. It's really crazy. It's funny. I didn't have no wheat for almost a month and a half.
Okay.
You know, and not because I just didn't find any areas that were trusted where I can actually have real wheat that's real 7 grain. And then when I started getting real wheat that was Brad, it's so funny when you fast, when you kill your flesh of the stuff that you've been eating for all these years, because you have to do a detox. I don't care who you are. Once you do a real detox, you almost become like a fiend, like a crackhead. You're like, give it to me. I need it, because we're so used to these certain type of foods, McDonald's or, 14 grain. But once you detox yourself and you start to do action, you start eating real food, you're like, where did this come from? Like you actually can taste your food. And that's what I noticed. I was like, I can actually taste my food now.
Yeah. Yeah. So our diets are big drivers of inflammation, and we don't know why, but for some reason, some epigenetic changes are made, and we just stay in this inflammatory state. So that's where a good detox protocol can help. I've done stem cell treatments where a host of other inflammatory type conditions are helped in the patient, because that's what they're so good at doing. Man, are they anti-inflammatory?
Oh no, definitely. And again, that's a whole nother show I'd like to actually talk on. But hey, people, I just want to say something before we leave here. There's a lot of people that actually go and travel to see Dr. Whitney. You can also find his website, innatehealthcare.org. You can also instant message him on this thread. Please do so. He'll be able to answer any of your questions. And let me tell you guys something. There's an old school saying that my mother-in-law used to say years ago. And she would say, a church alive is worth the drive. Let me tell you something. A doctor alive is worth the fly. Wow. So anyways, got to say that. And I want to say thank you so much, Dr. Travis, for being here on the show.
Yeah, thank you for having me. It's been a pleasure.
Hey, people, DM him. The phone number is on the screen. The website's right there. Give him a call and choose a doctor that can help you and change your life. If you guys are in the Phoenix, Arizona area, make sure you give Dr. Travis a call. And God bless you, Dr. Travis, and your business. And everyone out there, remember, one video can change one person's life. If you're not in pain, remember, 90% of the people on your news feed and Instagram, they're in pain. Let's share the video. Let's help people. God bless you all.